So you're thinking about LASIK? It's a huge decision, right? I mean, it can literally change the way you see the world. In this quick guide, we're going to give you a super clear, expert-backed framework so you can walk into that doctor's office feeling confident and ready to make a truly informed choice for your eyes.
Okay, let's just dive right in with a fact that might actually surprise you. For every 100 people who walk into a clinic wanting LASIK, only about 40 of them are actually good candidates. Yep, you heard that right. A full 60% are either pointed towards other options or find out they're not eligible at all. And that's exactly why a really thorough evaluation is, without a doubt, the most critical first step you can take.
So, here's the journey we're going to go on together. We'll start with that surprising 40% rule, then we'll cover the absolute must-have safety checks before any surgery. We'll look at the difference between a standard and a truly personalized treatment, walk through the super quick procedure itself, talk about what recovery really looks like, and then wrap up with the single most important decision you're going to have to make in this whole process.
All right, first up, let's unpack this surprising 40% rule. We're going to see why that first consultation isn't just a simple chat, it's literally the foundation for a safe and successful outcome.
This, of course, leads to the big question. What is it that puts someone in that 60% group that isn't ideal for LASIK? Well, it all comes down to the unique, one-of-a-kind anatomy of your eyes. You know, the main reasons are all about safety. If your cornea, that's the clear front part of your eye that the laser works on, is too thin, or if your prescription is really high, there just isn't enough tissue to work with safely. And other things, like having really severe dry eyes or an irregularly shaped cornea, can also be deal breakers. It's all about making sure your eye is healthy and stable enough for the procedure.
And that leads us perfectly into your pre-surgery safety checklist. Seriously, think of these tests like a pilot's pre-flight check. They are absolutely mandatory steps that help ensure the incredibly high 99.9% success rate of modern vision correction.
So here's the bottom line. Any good, reputable clinic will insist on a whole battery of tests. If any place suggests skipping some checks to save a little time or money, that is a major, major red flag. These tests are not optional, you guys. They are your safety net.
So what exactly are they looking for? Well, this stuff is actually pretty cool. The Pentacam creates this incredibly detailed 3D map of your cornea's shape and thickness. Then, the Corvus ST measures its strength, making sure it can handle the procedure. The eye trace maps out tiny little imperfections, which allows for a truly custom treatment. And of course, they'll do a dry eye test and a full retina check to make sure your eyes are healthy from front to back.
Okay, next up, let's talk about the procedures themselves. Ready-made versus tailor-made. A lot of people don't realize that LASIK isn't just one thing. There are actually different approaches with very different levels of personalization.
And the difference is, well, it's fundamental. Older, standard LASIK is kinda one size fits all. If you and 3 other people have the same prescription, you all get the exact same treatment. But modern, personalized procedures, they create a unique 3D model of your specific eye, mapping every tiny bump and imperfection. Then AI helps design a laser pattern that is 100% tailor-made just for you.
Dr. Rahil Chaudhria puts it perfectly. He says it's like the difference between buying a suit off the rack and getting one custom tailored. Sure, the ready-made one might fit, but the one that's crafted just for you, it's always going to have a much better fit and finish. The same exact thing goes for your vision.
Now let's get to the part that makes a lot of people a little nervous, the 15-minute procedure. Let's pull back the curtain on what actually happens on surgery day. And the good news is, it's unbelievably fast and comfortable.
For a lot of people, the most stressful thought is the laser itself. But just look at this number. The laser is only active on each eye for about 15 to 20 seconds. That's it. It's over before you really even have time to think about it.
And the entire procedure, from the moment you lie down to the moment you sit back up, takes only about 15 minutes total. It's an outpatient thing, and you're heading home to rest up just a little while later.
So what happens after those 15 minutes are up? Let's talk about the real recovery timeline, because you are probably going to be getting back to your normal life way faster than you might be imagining.
So get this, within just 24 hours, most people have about 99% of their clear vision back. In just 3 or 4 days, you can usually start driving and using screens again in moderation. After 2 weeks, you're clear to hit the gym, and after a month, you're good to go swimming. It's a really quick return to all the things you love to do.
Okay, so we've covered who's a candidate, the safety checks, the cool technology, and the fast recovery. But all of that brings us to our final and honestly our most important point, the most important decision. What is it that truly matters most in this entire process?
This quote from Dr. Chowdhury just says it all. The brand of the laser machine is just a tool. The real difference maker isn't the machine, it's the person using it. The surgeon's detailed planning, how they analyze your unique eye data, and their skill during the procedure, that is what determines your final outcome.
So after all the research into the technology and the recovery times, it really all comes down to this one simple thing. The technology is incredible, and the process is amazing, but the single most critical factor is the expertise and the judgment of your surgeon. So your most important decision isn't what technology you choose, but who. Who will you trust with your sight?